Push the wrong button. Please. Okay, bring the meeting to order. Thank you, conferees. Thank you, committee members, for being here. Thank you, staff, for being here. And today, first thing, we heard the budgets for Larned State Hospital and Osawatomie State Hospital. Committee, were there any recommendations that you came up with? I don't have any personally that I thought about. I think the governor's budget is a pretty good budget for this year. And I don't have any, but I'd certainly entertain any recommendation. Representative Ballard.
No, Mr. Chairman, I didn't have any. I was just going to recommend that we go with the governor's recommendation.
I have a recommendation. Second by Representative Helmer. Discussion. Seeing none, all in favor say aye. Aye. Opposed, same sign. Motion carries. Budget recommendations for Larned State Hospital and Osawatomie State Hospital are approved for 22 and 23. Very good. Next, we will have the budget hearing for Parsons State Hospital and Kansas Neurological Institute. And first up, we have Matt Moore. Matt, thank you for being here. And thank you for dealing with me.
Thank you, Mr. Chair, members of the committee, Matthew Moore, Legislative Research. Just for today, I just want to, did you want to start with Parsons or K&I? Is it? Sure. The agenda says Parsons, so I'll start with Parsons. Similar to yesterday, you'll see the BA before you. Just like with the mental health hospitals, this is both hospitals put together. The majority of the white pages are going to be those sort of hospitals commingled together. On page 14, you'll see K&I begins in the sort of light pink pages, and then Parsons begins on 18 in those sort of slate gray pages. So I'll begin there on page 18 with those slate gray pages for Parsons. You can see there's at the very top there the 10-year history of expenditures for the state hospital, as well as just some census information and some history of the hospitals. Page 19 is sort of some performance measures, and then just a little bit of explanation about the state hospitals. So one thing with the IDD hospitals is they do sort of both serve very different populations. Parsons generally, they both serve individuals who have intellectual disabilities, but the individuals who reside at Parsons tend to have more behavioral issues. And so that will be really a major difference between Parsons and K&I. On page 21, you can see the sort of chart breaking down the budget by category of expenditures. What I would note is that for 22, the agency's revised estimate was $31.9 million, including $13.4 million SGF. It's a increase of about $550,000, give or take, over what was approved. The increase is largely due to just the agency adjusting for costs associated with rising costs because of the pandemic, so supplies for the hospital, costs for food. The governor recommends $31.9 million, including $13.4 million SGF for expenditures. This is a decrease of $15,000, which is due to the governor not recommending the agency's supplemental request to begin development of a behavioral crisis unit, which I'll go into a little bit more depth here in just a moment. For 23, the agency requests $32.5 million, including $17.7 million SGF. This is an increase of $594,000 above the revised estimate. While there's not really a giant increase, what I would like to note is that there is an increase associated with some enhancement requests I'll go in here in a second relating to those executive directive increases. And for the governor recommended the agency's request for 23. I'll direct your attention to page 11 for the supplemental enhancements requests. The first one that's specific to Parsons is the development of a crisis stabilization unit. So this is, and I know that the agency has a little bit more in-depth discussion in their testimony, but my understanding is this is kind of the first in the state that you might have mental health crisis centers throughout the state and services that are provided through KDADS, but there's not really a place where individuals who have intellectual disabilities as well as mental health crises, there's not really a place specific for that population. And so the agency proposed to begin development of that, of a stabilization unit at Parsons. For FY22, they requested $15,000 to sort of begin some development, some remodel. That wasn't included in the governor's recommendation, but in FY23, they requested approximately $650,000 to staff that facility and begin receiving patients in that stabilization unit, which was included in the governor's recommendation. On page 12, this sort of covers both Parsons and K&I. As you'll recall, yesterday we had some discussions about the executive directives that were passed in the summer to increase the starting salaries for mental health and developmental disability technicians. For K&I and Parsons, those positions generally had started at about $12.35 an hour. And so the governor issued those executive directives to raise those to approximately about $16 an hour. For FY22, both hospitals, but were able to find sort of areas in the budget where they could kind of take on those costs, but then requested that an additional $2.7 million for Parsons specifically be included in the FY23 request to cover those costs. So for Parsons, that sort of amounted to the agency finding some savings in staff vacancies. They were able to take those costs that they had sort of saved because they had vacancies open and utilize those for those increases. However, in 23, it requested specifically the 2.8 million SGF to cover those costs and continue those salary increases. With that, like I said, the remainder of the BA provides a little bit more in depth on both hospitals together, but with that, I would stand for any questions.
Thank you, Matthew. Committee, are there any questions? Seeing none, all right, let's hear from KDAD's Deputy Secretary of Hospitals and Facilities, Scott Brunner.
Thank you, Madam Vice Chair, members of the committee. My name is Scott Brunner. I'm the Deputy Secretary for Hospitals and Facilities at KDADS. We spoke yesterday. We're talking about our two hospitals that serve individuals with intellectual and developmental disabilities today. Both of the superintendents are here, and I'll talk more about their facilities and the population. The slide deck will look very similar to what we talked about yesterday, and I won't belabor too much of the points where there's some common elements, but for the two hospitals that you're reviewing today, they both serve people with severe lifelong disabilities, primarily intellectual and developmental disabilities. And as Matthew said, the two hospitals serve a fairly different populations, and Barney and Mike Dixon will talk about that. On slide 3, it is important to note that we are both hospitals are surveyed by the Department of Health and Environment. Their intermediate care facilities for people with mental retardation by regulation. And so that's the federal criteria that they fall under as facilities. But although they're institutions and facilities where people live, both hospitals have a commitment to people having fulfilled person-centered lives and planning care around their needs that are unique to them. On slide 4 is the kind of comparison of budgeted bed capacity to census and staffing, similar to what I showed you yesterday for Larned and Osawatomie state hospitals. And you can see that both KNI and Parsons are a little bit below their full budgeted capacity. Some of that is COVID isolation needs, primarily as staffing but again, superintendents can talk a little bit more about that. And then the authorized positions are there too to give you a sense of scale. On the next slide, number 5, is the turnover rate and vacancy rate. And if you recall these numbers from yesterday with the state mental health hospitals, these are substantially lower than Larned and Osawatomie experience, but they're significantly higher than we would like to see and then that our historical rates are. For turnover rate, it's 38, a little over 38% at KNI and 22.6% at Parsons. These are measured since January 1st of this year in this fiscal year. That doesn't have enough time to really show the impact of the 24/7 pay plan and even some of the pay plan items that we talked about yesterday, but we do expect those to have some impact going forward. And then the vacancy rate for positions you can see are both around 20%. So that's 1 in 5 of our authorized positions. I might just jump ahead then, and so the superintendents can have some additional time to present to you, and you can ask them questions. I'm going to jump ahead to slide number 9 and just highlight the enhancements that are in the governor's budget that affect our whole system, but in particular KNI and Parsons. Like we talked about yesterday, there was an executive directive over the summer that raised the starting wage for our frontline direct care workers to get them up to $16.16 an hour, and you can see the impact across the hospitals. This was a big jump for Parsons and KNI to get them up to $16.16 an hour from where they were, so the dollar amounts are higher there. And you can see that the governor's budget, we funded that on our own for fiscal year 2022, and the governor's added funding to keep that going through fiscal 2023. The 5% state employee pay raise is in for all agencies, and again, that doesn't appear in any budget specifically, but is certainly a part of the package that we want to offer to employees to come work at both hospitals and stay if they're already employed. And then on the second, or the next page on slide 10, the 24/7 pay plan, because both of these hospitals also operate 24 hours a day, 7 days a week, and have staff there all the time, they're eligible for these both hourly differential payments, and the nursing staff that work at both hospitals got that base pay increase as well. The one difference between the Larned and Osawatomie impact and Parsons and KNI, of the 4 differentials, hourly differential payment amounts, Parsons and KNI aren't eligible for the 4th differential, the $250 an hour, because their vacancy rate's not over 25%. It's really close to 25%, but it's not 25%. So they're only getting 2 of the differentials, not 3. And that is included in the governor's budget. The Spark money is financing that for the remainder of this fiscal year, and there's state general fund money in the budget to fund that through fiscal year 2023. Those are the, Matthew mentioned the one other enhancement that's at Parsons State Hospital for the security behavior unit. Superintendent Dixon can talk about that during his presentation as well, but I wanted to give you that kind of system level perspective as a place to start. Happy to take any questions now, or can proceed on with the superintendents if that's okay.
Great, thank you, Scott. Committee, any questions? All right, I guess we're up to Mike Dixon from Parsons State Hospital.
Thank you, Madam Vice Chair, members of the committee. I am Mike Dixon, the superintendent at Parsons State Hospital. My presentation actually starts on slide 25. Parsons currently serves 145 individuals on 9 different residential units. There's 12 to 21 individuals on each cottage. Last fiscal year, we discharged 15 people and admitted 9. 39% of our population are in the severe to profound level of intellectual disabilities, almost 35% in the moderate range, and almost 26% in the mild range. Approximately 30% of our population have intensive specialized medical needs, very similar to what you see at K&I. The 26 is just overtime from 2015 through the end of last year, how many people we brought in and discharged. The next several slides is just really looking at our population. As Deputy Bruner and Matthew said, or Deputy Secretary Bruner and Matthew, we at Parsons really do have a lot of different behavioral issues that we do every day. Slide 27, 89% of the individuals are dually diagnosed and 82% have a serious mental health condition. Slide 28, 84% of our individuals engage in some type of physical aggression, 68% destroy property, and 67% engage in self-injury. 29 really looks at the level of supervision that our individuals have to have at Parsons. 94%, all but 9 of our individuals are on some level of increased supervision. 6 currently, and this changes daily, these numbers are really fluid based on what behavioral issues they're having, but 6 individuals right now are on one-on-one supervision, which means we have to take that staff completely out of the count. All they do, if we have 5 staff working that night and we have a one-on-one on a unit, that staff comes out of the count and they're just assigned to that one individual for the entire, they don't do any, they have no other job responsibilities except that one individual. 61% or 88 out of the 145 have to have their own room due to behavioral issues. Slide 30 is looking at the admissions that we brought in over from 2012 through 2021, how many had police involvement. And you can see in 2021, 67% of the people we admitted did have some involvement with the police prior to admission. We do have, and this is separate from the SPTP reintegration facility that we have on campus at Parsons, we do have an inpatient program for individuals who have engaged in sexual offenses in the back, sexual acting out. During fiscal year 2021, we assessed or treated 18 inpatients that fall in that category and provided training to over 150 community agency staff regarding individuals in their agencies. Slide 32, we've had some systemic changes at Parsons, some philosophical changes over the last year. Prior to this past summer, we trained our staff in crisis intervention training, which is a form of de-escalation and restraint. We've moved away from that to CPI, crisis prevention intervention with advanced holds. It's a 4-day class now, and it teaches our staff much more upfront what to do to avoid and we're moving our language away from it too. We're no longer referring it to as restraints. They're now safety holds. But it took us actually 6 months to get all of our staff trained in the new safety holds. We also implemented, starting in July, trauma-informed care with all of our individuals that live at Parsons, and within the training, there's techniques and procedures that can be applied to staff that work at Parsons also. Slide 33 is our performance-based budgeting results. 34 is some of the additional programs that we have at Parsons. We are affiliated with KU, and through KU, they provide respite services. There's a payee program, and coordinated resource support services. There's also a Kansas equipment exchange and a TAP, or a telecommunications access program. We were able in fiscal year 21 to get our outreach group much more involved in the community. as you remember from, I'm sure, years past, we have a group of behavior analysts that only a couple live in Parsons. The rest live in the Wichita area, in the Kansas City area, and they go into community agencies, homes, schools, and help them develop behavior support plans to keep people in the community so they don't have to be institutionalized. During fiscal year 21, they served 131 individuals in 33 different counties. We have a really active vocational site at Parsons. 76% of our individuals participate in some vocational site. Through 36 and slide 37 are the different vocational opportunities that we offer. We have a very active adult self-advocacy group at Parsons that they elect their own president, vice president, treasurer. They have lots of different organizations and charities that they contribute to every year. On through 38 is a lot of things that they work on every year. They are really big. I know prior to the state hospital's testimony yesterday, there was testimony from KDHE about the dental services. And that is a big thing for our advocacy group, going out and educating people on the importance of taking care of your teeth. We redid our staff training over the past year also. Historically, when new staff came in, they'd get 2 days up front, and then we worked with Labette Community College and did a 15-hour training that actually lasted over the course of a year. At the end of the year, after they took the courses, they would get their certificate. We're doing that all up front now. We're trying to get all the staff all of the training they need prior to going out of the cottages, on the cottages. Slide 41, as we testified to yesterday, COVID has been really hard at Parsons as well. Since January 1st of just this past year, we've had 29 individuals test positive, but 113 staff just in the last 5 to 6 weeks. Today, as of today, we have 34 staff currently positive and 11 individuals. I'll skip to slide 43 and talk a little bit about the Behavioral Crisis Stabilization Unit. We get calls frequently, not just at Parsons, but also at Osawatomie and LSH as well, and I'm sure at K&I, of people that are in crisis in the community. They're in an emergency room someplace, and there's just no place for them to go. It's people with an intellectual disability. They're extremely aggressive, self-injurious. This isn't somebody that's real appropriate for Osawatomie or LSH. So there's just no place for these people to go. So we started talking last year about what can we do at Parsons. We do have skill in this area. So we would like to create a behavioral crisis stabilization unit and be able to bring in a small number of people, get them stabilized, and then get them back into their community agency. It wouldn't be a long-term placement at Parsons, it would be short. With that, I will stand for questions.
Committee questions. Representative Ruiz. Thank you.
Go back to my slides here. Slide 30. Do it. The police involvement, can you give some examples of what that means? Like if it's something that would be, well, let me just ask, in general, what would be some of the reasons why there would be police involvement?
It's usually pretty severe. It's throwing bricks through car windows or having some type of behavioral episode at a doctor's office and maybe trashing the lobby, attacking other individuals, attacking, a lot of times it's not staff, it's people in the community. But it usually involves some pretty serious property destruction or aggression.
Okay. If police were involved as far as someone calling them just to try to de-escalate a situation, is that counted towards this? Okay, all right. Okay. The next one had to do with the some of the vocational programs. I'm just curious about, let me get to that page.
Slide 36.
36. There it goes, yes. Are these things that are sold, like the toner refill and recycling? It says provides low cost. What happens to the revenue that is?
It is reabsorbed within the hospital.
Okay. And are they, are the people that are, the residents that are providing that service, do they get paid a salary or
They
something?
do, and it's very competitive. It's above minimum wage.
Above minimum? Okay. All right, I'll just keep to those two. Thank you so much.
Representative Helmer.
Thank you, Mr. Chairman. I'm on slide 43. I really like this idea of a behavior crisis stabilization unit, but I'm not understanding the overall everything of it. Are you just talking about in your area, or is this 644,388 something to fund a program, a behavioral crisis stabilization, but it just says unit to start statewide for different areas?
Yeah, our catchment area would be statewide.
Okay, that's what I was wondering, because
It would be housed at Parsons.
it would just be Parsons?
It would be housed at Parsons. The unit would actually be at Parsons. We're going to incorporate this with our outreach, who goes all over the state of Kansas to help stabilize people in the community. So I can see it getting referrals from them. They go out and they're not able to stabilize them in the community, so they make a referral to the crisis stabilization unit. We'll bring them in. We'll have staff that can work with them and do intense behavioral support, maybe some medication adjustments, and then hopefully get them back out into the community.
Hey, may I pose one more question? Okay, well then, as my previous experience as a school counselor, we had a lot of difficulty placing students that were in a trauma experience that we had no place to send them. And there were just no beds to send them. So could this cover a child that was in that type of an experience when, because a police department is not a good place to send a child that's in that type of, having that kind of trauma?
It absolutely will serve children. They will have to meet certain criteria. They'll have to have an intellectual disability to get into the system that we're in at Parsons. So most of the individuals that will be served by the program will come from a CDDO in Kansas and already have housing, or so the goal with them would be to get them back.
Okay. Thank you very much. Thank you, Mr. Chairman.
Representative Ballard.
Thank you, Mr. Chairman. I am really impressed with the vocational and the advocacy. I'm just looking at this list of all kinds of things that they can do. I have a personal request. I have a dog that I love dearly. And I see you have down here doggy bones. So do you sell those to the public?
We do sell them to the public. Anytime anyone visits, they become a return customer. We'll ship them. So get me your contact information and we'll ship you some dog biscuits. So.
Well, I think that's pretty cool. Now charge me. Well, yeah.
Okay.
Yeah, charge me. That's pretty cool. Now, the other thing is, I see here where you have dental. So, adult dental is something that we're interested in. But then it says provided every other year. Would you explain that program?
This is just the in-service at the STAND advocacy group. It's individuals who live at Parsons, and they go out and discuss the importance of hygiene, taking care of your teeth with all the people that live at Parsons Hospital. We have a dentist on what we contract, and he comes in every other week and takes care of our individuals' teeth. So it's just extremely important.
It really is. Thank you, Mr. Chairman.
Representative Clifford.
Thank you, Mr. Chairman. So in 2022, the governor did not recommend the $15,000 to develop the unit. Are you just going to do a DIY project or something, or to get ready for the funded portion in 23?
It's not a huge lift to get ready for the project. We're going to take a wing of we have a hospital on campus, and there's a wing that we're going to use. We won't have the startup costs to start hiring the staff until July 1. So we're probably looking at probably a September kickoff date, and we'll be able to get it done in that time. Did that answer your question?
Yes, so you don't need us to restore it, in other words.
I think we're okay.
Thank you. Thank you, Mr. Chairman.
Yeah, just think about this, 22 ends in July. So by the time our budget's done in May, there's maybe a month probably before we could even get the money to them for 22. So traditionally, unless it's something that's, pretty necessary, we don't do much with the 22 budget, just because they just don't get it very fast. So anyway, Representative Howerton.
Thank you, Mr. Chairman. I just wanted to say on a personal privilege that I have known Mike Dixon for 27 years. He was a groomsman in our wedding, and I have not seen him in those 27 years, so I am very thrilled that he is here. And he has actually worked at Parsons Hospital since you were 17?
Right out of high school, 18.
Right out of high school. So he has been there and come up through the ranks, and just proud of the work that you've done. It's great to hear it.
Very good.
Thank you.
Thank you for that. Any further questions? Okay, seeing none. Are we on K&I now? You did Parsons first? Okay, good. I didn't miss that much then. I apologize for being gone. I was in another meeting that was, I'm not going to say it's important to a lot of people, but it was important to me, so.
Chair, members of the committee, I'll move on to K&I here. I'll start on page 14. With the rest of the hospitals, as you can see, there's the 10-year history there at the top, some census statistics there at the bottom of page 13. 15, you'll have those performance measures. What I will note is where we indicated that Parsons, the population is more, has behavioral issues. At K&I, the population is more kind of an aging population with medical needs. So that's sort of the difference in between the two. Parsons more behavioral, K&I is that older population with severe medical needs. On page 17, you'll see that chart with the categories of expenditures and breaking down the budget itself. I'll note, so the agency requested $28.6 million for 22 with 10.1 million SGF. This is an increase of approximately $2 million, which is due, again, largely to that executive directive, those funds to fund those salary increases. In FY22, the agency was able to find some federal funds due to the increase in the FMAP, which I know that you've heard before. Due to the pandemic, there's that increase in the federal match assistance, federal medical assistance percentage rate of 6.2% that continues. Originally, when they did their 22 budget, we anticipated that to end prior to 22. As that public health emergency continues to get pushed back, that funding continues and frees up some funds. So the agency was able to have some extra federal funds that it was able to utilize for this, to continue those salary increases. The governor concurs with the agency's revised estimate. For 23, the request was for 28.5 million. Which is 14 million SGF. This is a decrease of about $122,000. Again, that that decrease is just generally shifting expenditures based off of what it anticipates needing for supplies. With 23, what I would point out as there at the bottom, you can see that the agency is also shifting about $4 million from special revenue funds with SGF funds. And that simply is, as I indicated with that temporary FMAP, currently when the agency submitted its budget, anticipated that FMAP would end and not continue into 23. So my understanding is that the public health emergency has been extended, I believe, until April. So that FMAP is anticipated to end with the fiscal year 22, but should that continue, then there might be some more federal funds going to 23. But right now, the agency is anticipating to continue the same level of spending. It's just because of that, the ending of that FMAP increase, what was once used with federal funds now has to be used with SGF. And you can sort of see that in that figure. The total is about that $28 million, but the shift there in that financing you can see is mainly due to shifting from from federal funds in the GovRec in 22 to SGF in 23. And then I would just draw your attention to page 12. Again, that's the discussion of the executive directives and the salary increases. Again, agency was able to fund it for 22, but is requesting SGF to continue that funding into 23. I would also just note, I forgot to mention with Parsons, page 5, you can see the agency fee funds, much like with Osawatomie and Larned. Those are recoupments for private pay insurance and some Medicare costs. So those are the two charts kind of detailing expenditures for the fee funds. But with that, I would stand for any questions.
Any questions? Very good. You must have done a great job, Matt. Okay, next I have Scott. Are you up? Okay, very good. Thank you, Scott.
Just to introduce your next speaker. So Barney Hubert's our acting superintendent at KNI. If you're on the committee last year, Brent Wittig had been our superintendent for the last 7 or 8 years, and he retired at the end of the year. And while we were looking for a replacement and for KNI for a permanent spot, we talked to Barney and asked him to come back and help us in an acting capacity. He was superintendent before Brent, and so he's got great experience with the hospital and has been a real asset to us in both to have the leadership gap while we're making that transition. But I'll have Barney come up and he'll talk to you about
Okay, very good. What was your last name, Barney? Hubert. Barney Hubert. Okay, very good. Thank you for being here.
All right, Mr. Chairman, members of the committee, I am Barney Hubert, Interim Superintendent at Kansas Neurological Institute. And my presentation starts with slide 13. And it starts with our mission at KNI, which is to support each person living there to have a meaningful life. We've identified really 5 main areas that we focus on in doing that, and certainly at the top is ensuring people's well-being. But we also want people to have opportunities for choice, to develop relationships, to do things in the community, and to recognize them as the unique individuals that they are. So we focus everything we do on those things. Slide 14 has some information about the folks who live at KNI. There are currently 129 people living at KNI. We're on target to admit a 130th in about a week and a half. And they live in 20 different homes, typically 6 to 8 people living in each home. And as has been talked about before, 94% of the folks living at KNI are people with profound intellectual disabilities. And what I really want to stress in this slide is that KNI is home to the people who live there. You'll see that 29% have lived there for over 50 years. 78% have lived at KNI for more than 10 years. So it really is a long-term home for the folks who live there. And that sort of ties in with it being something of an aging population. I think 68% of the folks living at KNI are over 50 years of age at this point, and we have people going up into their 70s. At the same time, we've admitted 43 people over the last decade, so typically about 5 a year. And in 2021, we did admit 7 people, and then this will be our first in 2022 who's coming in about 10 days. And only 6% of the folks living at KNI are under 30 at present. On slide 15, it talks about some of the healthcare needs. As I said before, 94% of the folks have profound intellectual disabilities, but many have co-occurring physical disabilities, such as over half are unable to walk, over 90% unable to speak, about 2/3 have seizures, about a quarter have an autism diagnosis, and just lots of other issues. Only about 1/3 are unable to eat by mouth, so they get their nutrition through tubes. Another 1/3 require modified diets in order to eat because of swallowing issues, and about 10% have trachs, and a lot have respiratory issues that require breathing treatments and things like that. On slide 16 is a summary of our COVID things like vaccinations and tests, and we have had no people living at KNI pass away from COVID. We've had no staff pass away. We've had a few in the hospital. And yeah, Barbara Ballard is knocking on wood, I see, Representative Ballard. And pretty much everyone has recovered from COVID if they've had COVID. We've had a lot of initiatives related to COVID, a lot of protocols, a lot of contact with our local health department, and we're fortunate in that 98% of the folks living at KNI are vaccinated, over 90% are boosted, and that's based on the preference of their guardians, because they are all are folks who have guardians. Slide 18 goes into some of our accomplishments over the past year, and certainly we're proud of our COVID response and the fact that that no one has passed, and in fact we've had no one directly hospitalized among the people who live at KNI as a result of COVID over the past year. We feel that the people we've admitted, we've done that successfully. We survey our guardians each year because, again, with 90% of the folks that living at KNI being unable to speak, it's important to get that feedback. And we do a 19-page survey, and on a scale with 5 being highly agreeing with the statements, the average on all of those 19 items is between 4.5 and 4.8, showing a high degree of satisfaction. We've streamlined our training in light of COVID when some in-person training hasn't been possible. We've tried to focus in on those things that are most important for staff coming in. And we've been able to continue some of the community outreach that we do that's important to us and important to the community. Slide 19 goes into some of the initiatives that we've identified going forward. And certainly the issue of stabilizing our direct support workforce and our nursing workforce are sort of at the top of the list. We've had a very high turnover rate among direct support professionals. We have seen since the advent of the increased wage, our vacancy rate has dropped from about 30% down to about 23% over those months. So we do see the effect of that. We also want to expand training on our mission for staff who've come in during the pandemic. Many of those staff, the focus again has been on health and safety. People haven't been as involved in the community, in some of the relationships that they have, in the jobs that they have. And so we want to focus on the training necessary for staff to resume those duties moving forward. And then again, opportunities for community inclusion and work. About 70% of the folks living at KNI have jobs, often little niche jobs, and we have 5 businesses that we operate on campus, a balloon shop, a plant shop, a little cafe, a book nook, and a thrift store. So those are on campus, and then there's other businesses that are off campus. And then we want to more effectively meet the needs of new staff coming in related to training, and again, increasing the amount of community outreach that we do. On slide 20, it talks about some of the things we do in terms of community outreach and community support. And some of those things I think that are probably most prominent are some of the assistive technology assistance that we provide. We have some people who are skilled in modifying wheelchairs. We're one of 4 recognized seating clinics in the state. And people do some things to just help people have more control over their environments and more access to their communities in the work that they do. We also do a modest amount of dental outreach. We have a dentist who comes in 1 day a week, and around meeting the needs of people living at KNI, he's able to see a few people who have intellectual disabilities, who have trouble accessing those services elsewhere. And so those are some of the key things that we do in terms of outreach. And then on slide 21, it mentions some of the community partnerships that we have. And again, with those, some of those have been curtailed a bit during the pandemic, but we want to increase those to the extent possible. Slide 22 talks about the changes in our approved budget, and Deputy Secretary Bruner has talked about that, and Matthew's talked about that, so I won't go into that. And the same with slide 23. And with that, I will stand for any questions that you might have.
Committee questions? Representative Clifford.
I think you have an appallingly low staff vaccination rate. I mean, what's the resistance, or what have you determined to be the resistance to vaccination?
Actually, the number that's listed there, we know that with a requirement, a CMS requirement for vaccination coming, we've really pushed that, and we should be up close to 70% here soon. But I think it's partly that we have a pretty large workforce of folks who have just made their personal decisions, and we certainly provide lots of education regarding vaccinations. We offer vaccinations on a very frequent basis, but we haven't been in a position to require staff to be vaccinated. And, just based on their personal decisions, despite the fact that that we continue to encourage vaccinations and offer them on a frequent basis, we've had a significant number of our staff who have not availed themselves of that opportunity. But we do continue. And again, here, just even in the last 2 weeks, we've really been emphasizing that and have offered multiple opportunities for people and have had more. And in some instances, we've also found there were people who were vaccinated outside of the facility who we weren't aware of, and they've informed us of the fact that they are vaccinated.
In contrast, your residents seem to be highly vaccinated, and are guardians requesting those? I assume these are individuals who could not voluntarily consent.
That's correct. And yes, with the people who live at KNI, guardians were asked, do you give consent for us to vaccinate? And again, of the 129 people, 126 said yes. Boosters, a little lower, but still over 90% have been boosted.
So they're protected from the staff.
We've found, actually, with the Omicron variant, we have found an awful lot of people who are vaccinated and boosted have been infected, but we've also found that they're consistently or more frequently, back at work more quickly, that symptoms abate more quickly. And I know there's one person in the hospital currently who had been a person who did not want to be vaccinated, and now he's saying, when I come back to work, I want to be vaccinated.
Thank you, Mr. Chairman.
Sure.
Any further questions? Representative Ballard.
Thank you. Of those 5 shops that you have,
Of the
the five shops you have, I'm
Yes.
sorry, directly with the balloons, the plants, and all of that, they also provide to the public, am I correct?
That's correct. We've had to limit that some because of caution related to COVID, but have been doing curbside deliveries. With the plant shop, there's actually a business in town where they've given permission for them to display and sell through that business. But we're hoping soon to get back to the sort of wide open public aspect of those businesses.
I ask you that question because whenever we've come out to tour, that has been delightful to look at it because they take pride. I mean, this is their shop, they're running it, and they're talking to you about what it is.
Yes.
I think, several years ago, we ordered several balloons that someone else picked up and stuffed in their car and brought out here for them. So, I mean, that is another opportunity for them. What is your absenteeism like?
Among
As far as
staff,
workers, wrong staff.
it's certainly higher than we would want it to be. And I think, as Deputy Secretary Bruner said, I retired from KNI 8 years ago, and I've been back for a little over 2 months. I do notice, I think, some differences in the workforce, and it's something that we do monitor. And since I've been back, I've been monitoring that closely and trying to address some of those performance issues if there is excessive absenteeism. I couldn't tell you a specific rate, but it is something that we find is higher than we would want it to be.
You answered my other question because I know you had retired and you were back again, so I thought that was interesting. I don't know if everyone realizes, but I would say a lot of your living accommodations are theme-oriented. I think when we come, if you would look at, say, a room that they have, they're able to decorate it the way they want to. So if it's an Elvis Presley person, or if it's I can't think of all the different themes, but they have decorated it, and it's like a home, how you would do it in your own home. And since, as you indicate, they've been there over 50 years or whatever, I mean, this is your home. There's no other place.
Thank you. Again, the homes are 6 to 8 people. In 2 of our there's 4 residential buildings, 2 of those in which there are 11 of the homes. People have 1-person bedrooms, and years ago we modified what had been designed as 4-person bedrooms, split them in half, and made them 1-person bedrooms. And so they're very individualized. And then in 2 of the buildings where they require more accessibility accommodations, there are no more than 2 people sharing those very, very large rooms, and some natural dividers, and people definitely decorating their space in ways that reflect their interests, whether it's Kansas Jayhawks, K-State Wildcats, in one case, I think Texas Longhorns, Elvis, Barry Manilow, whoever they're most interested in.
My last question, are you still under the moratorium that not just anyone can come to KNI? Remember how that was, unless they cannot find the services in the community?
There's a gatekeeping process that goes through KDAD's central office, and so there's people who, if a person is seeking admission or having trouble finding the services they need through the community services system, they would go through a gatekeeping process, and then if they pass through that process, they might be referred to us, and then we would convene an admission committee and determine whether we could successfully meet the needs of that person. And also we look at, if we're looking at a home that they might go into, what effect that might have on others living in that home, and try to have compatible living arrangements with people who, again, sometimes they wind up, they certainly share space, but they may not share lives in some cases. But there is that process in place, yes.
So much.
Thank you.
Committee, further questions? Representative Howerton.
Thank you, Mr. Chair. I'm not familiar with your hospital. So are people born with the neurological, or are they?
I would personally feel that KNI was developed in 1960 and probably is misnamed in some ways because they are people who have intellectual disabilities. Most of them, they're disabilities that occur before or at birth. Occasionally, there may be instances of a childhood illness, meningitis or There may be instances in which even a childhood injury of some sort, but most of them are at or before birth.
Okay, thank you. I had a roommate that worked with neurological, and it was brain injury, so I was trying to connect the two.
Right.
Thank you for clarification.
Representative Donahoe.
Thank you, Mr. Chairman. So I want to make sure I understand. So you've had no incident of COVID with the occupants?
We have had quite a few, I think, between 60 and 70 people who live there, but they have all
They survived?
they've all survived, and in most cases, they've often been mildly symptomatic, and then if one person in a home tests positive, we'll test everyone, and so we may find other people who are totally asymptomatic, but who do test positive, and we've, in some cases, been able to isolate people. In other cases, it's been we to the extent possible, if there are people who are active and moving around, we isolate to the extent possible and monitor within that home.
Yeah, was this before vaccination or after, or just random?
It's been both, and as Superintendent Dixon said, with the Omicron variant, we've had I'd say more infections through that, but presently, we have no one living at KNI who is testing positive, and we've only got currently about 4 or 5 staff out who have tested positive.
Have you had any deaths in staff?
No, we've had no deaths in staff. Again, some hospitalizations, 1 current hospitalization, okay, but no deaths among staff.
Any further questions? Very good. Thank you very much for being here. Next up, I have no stranger to this committee, and I mean that in a good way, Joan. Okay, very good. Joan Kelly. Very good. Thank you for being here.
Thank you, Chairman Carpenter. Good afternoon, members of the committee. My name is Joan Kelly, and I so appreciate the opportunity to speak today on behalf of our most fragile citizens who are not able to protect or defend themselves. Pardon me, I'll try to be more professional. I'm delighted that today,
Just take your time.
Thank you. I'm delighted that my precious husband is here with me today. He's been the best teammate in raising our grandson, who is now 31 years of age. We raised him in the community from the time he was 2 years old. And after, he's affected with profound autism. And I just want to, not to take issue with Matt or anybody else, but there are some new younger gentlemen who are living in the home where my grandson lives now. And I'm actually kind of delighted, but they are similar to some of the people who live at Parsons. They're extremely dangerous to themselves and others, and have extremely dangerous behaviors on an unpredictable basis. So since Aiden was 2 years old, we raised him in community. I believe in community, but I have to tell you that we experienced and endured a number of community failures over a number of years, and we are so grateful for KNI, where our grandson has lived since 2008. Although federal and Medicaid law both require that states offer a choice of either community or ICF, our gatekeeping policies in the state of Kansas, as Representative Ballard brought up, they actually require families to first prove that they've exhausted all community options. And while we were in crisis with Aiden, we had to prove that. And I have great sympathy for the parents, because when you're in crisis, you're struggling to just maintain a 24/7 round-the-clock thing, perhaps understaffed, and the system doesn't work well, and yet here you are required. There's a capricious interpretation at times of the burden of proof that's laid on dedicated families, and I hope that at some point we will look at the dishonor showed to dedicated families by requiring some sort of burden of proof on families in crisis. We certainly had to pass that process back in 2008, so it's gone on for quite a few years. I've attached today one of the testimonies of what happened in the gatekeeping process, whose loved one was eventually admitted to KNI, and I think you all have that. If I seem a little bit like I'm diverted today, it's because I understand that this esteemed committee has a big job. There's only so many tax dollars, and you have to decide, although this is mainly budget recommendations from the governor, you have people competing often for the same funds. So I want to, most of you may know that there's a number of well-funded research projects across the country which definitely have a lasting, profound impact on IDD public policy. And although they're mostly widely respected, I have come to find out after doing my own due diligence that a lot of the so-called research data has created an alarming distortion of truth. And, excuse me, while there's many entities who have a lot of money to do research and so forth, I'm going to focus on one today. United Cerebral Palsy is a national organization that promote only community, and I'll just refer to them as UCP from now on, if that's okay. UCP prides themselves in their annual report called A Case for Inclusion. It's used by lobbyists across the nation to celebrate facility closures. It claims that people, like our grandson who lives at KNI, that he's languishing there. Now, we visit him every other week, barring COVID restrictions, and I can assure you that he is not languishing at KNI, and neither are the other residents. UCP claimed a few years ago that the state of Georgia, this is just an example, I think it's good that we be informed, was among the toply rated states for implementing inclusion policies. And yet UCP, this national organization, completely ignored the tragic outcomes that occurred in the state of Georgia under the U.S. Department of Justice's protracted litigation. This went on for a number of years there, and it was conducted largely out of the public eye. Now, I know this, ladies and gentlemen, because I do work, not only am I vice president for our parent guardian group, but I work with families across the nation whose loved ones live in facilities like KNI. The DOJ settlement there, the agreement required a timeline of transfer of the most helpless individuals and allegedly to more appropriate settings, and yet the DOJ decision contributed to a number of untimely deaths of the profoundly helpless people living in the state of Georgia. I can hardly think about that without crying. I did submit some, I realize you all are pretty busy with many things, but I wanted you to see that someone did some investigative journalism to expose what had happened there. You know, I think we have to ask ourselves how much credibility we're going to place on Mathematica research, United Cerebral Palsy's reliance on, quite frankly, false data that's collected by an affiliated organization called National Core Indicators. Their safety data, National Core Indicators' only safety data asks one question: do you feel safe? Well, since most of the people at KNI are nonverbal, they're not going to be able to respond to that, and the ones who can talk would probably have great difficulty expressing if they felt safe or not. You know, despite these tragedies in Georgia, the executive director of the DD Council there still said, knowing all these deaths, you guys, we believe no one should be living in an institution. I think we can all agree that not all parents and family members have the physical, mental, and financial capacity to provide 24/7 care year after year for their loved ones who have profound functional impairments. We continue to hear heart-wrenching stories at the Bob Bethel Committee while the direct support and nursing staff crisis continues, and bringing those families to the brink of exhaustion and collapse. Just incidentally, the direct support staffing crisis was identified in this state in 2003 by the Kansas Council on Developmental Disabilities. It was acknowledged by ANCOR, which is the American Network of Community Options and Resources. They've been aware of this for a number of years. And yet very little has been done to build capacity in the area of nursing and direct support staff crisis. And I just have to be honest and say that over the last 19 years, I don't think we can blame this failure on 2 years of COVID. I hope you'll forgive me if I'm too blunt, but I feel like it's important that, and I'm just going to take a couple more minutes, but feel like it's important for you to get a perspective beyond how many beds and, costs, because they are our loved ones. One thing that perhaps you may or may not know is that there are undisclosed amounts of money siphoned off every year to provider CEOs and upper management salaries. And the last rate study that was done in our state that I'm aware of in 2016, the upper management provider CEOs and upper management excluded themselves from any accountability on what their salaries were. So when we look at a budget for, for community situations, I think we have to consider why that might be the case. And just one example, the state of Massachusetts, they were also rated very high by United Cerebral Palsy for a number of years. And yet, in those same years where they received high ratings, I have in front of me the Department of Health and Human Services Office of Inspector General. It says Massachusetts did not comply with federal or state requirements for critical incidents involving developmentally disabled Medicaid beneficiaries. So while UCP rated them high, apparently our federal officer of Inspector General did not agree. Also, after a careful review, it was revealed after reviewing the tax forms that in the state of Massachusetts, the compensation of provider executives exceeded $100 million. Now, I realize that your focus is a certain thing today, but I would just respectfully ask, wouldn't it behoove us to look at the amount of tax dollars to require some disclosure of how much is actually going, how many people, what percentage of people are actually receiving six-figure incomes within the provider system, since we have such an ongoing direct support staff crisis? Wouldn't it, and I say that with all due respect, to clarify in any of your budget recommendations that increases go strictly to nursing pay and direct care staff, and begin to really alleviate the crisis imposed on Kansas families? I'm going to close now. Thank you for your patience with me and listening. It's an honor to speak for those who can't speak for themselves, and it goes way beyond our grandson. But recently, I've come to understand that in the legislative process, by people who understand it much better than I do, that most of what I shared to you in some ways doesn't really matter. What I've come to understand, and please correct me if I'm wrong, but if a governor doesn't include budget enhancements, it's very unlikely that any discussion to include desperately needed enhancements for K&I would be successful. I respectfully then ask this committee, regardless of what the FMAP is, whatever federal match is there or is not in future years, I think we want to ask all of ourselves, are we willing to do the right thing for the weakest among us, no matter what it takes? And if we're not, what are we becoming as a state? If we won't care for what someone has referred to as the least of these, our brethren, then who will? And I thank you so much again, and I'm happy to answer any questions.
Very good. Thank you, Joan, for those comments. Committee questions. Representative Ballard.
Thank you, Mr. Chairman. I don't really have a question, and I've heard you before. I have to say I really admire your passion. And, your grandson since he was 2. And I think it's advocating. But what I think I admire the most is you haven't just advocated for him. You have advocated for those that you don't know, trying to get it set up so that those facilities are available, because we've gone through when they wanted to close K&I.
Thank you.
Did not, and we had the moratorium was put on so that unless you couldn't go to the community, you couldn't come. And you have been there through all of that. So I say thank you very much.
Thank you, Representative Bauer.
Representative Howerton.
Thank you, Mr. Chair. And I echo those thoughts, and this is my first year on this committee, but I do appreciate, and we do listen. We do, and we do hear you, and you do make a difference speaking up, and one person can make a difference. I just want to encourage you in that.
Thank you.
Very good. Committee, further questions? Well, I and Joan have quite a few conversations outside of this committee, and I appreciate that very much because I know exactly where she comes from every time.
Thank you.
Thank you very much.
I didn't want to overburden this committee with peripheral documentation, but if anyone is interested in looking at the ratings that United Cerebral Palsy put out through the years, I'd be happy to submit that to you now or later, so just let me know.
That would be fine if you would, can you give that to Francie and she can scan it in? Do you have an electronic copy of that or?
It's such a huge
Okay.
of paperwork, I just scanned certain pages
Maybe she can scan that in and send it out to the committee if that's okay. Okay, very good. Thank you very much. And it's a pleasure meeting you, sir. I have not met you before, had a lot of conversation with your wife, but welcome to committee. So maybe. Okay, committee, further questions? Okay, that concludes the hearing on K&I and Parsons. Committee, we will start, we will do recommendations for these hospitals on Monday, and we will start Department of Children and Families hearing. So with that, we're adjourned.